When we got the diagnosis of spina bifida, it was unexpected and very emotional.
Spina bifida is a condition where the spinal cord, instead of being completely encased within the spine and covered by skin, of course, is in some places exposed to the outside world, or before the baby is born, to the uterine cavity. Because of the damage to the nerves, it can have an impact on leg motion, on bladder control, bowel control, also on hydrocephalus, or water on the brain. Typical treatment is to repair this as soon as possible after baby is born. What Selwyn went through was a repair of the spinal cord even before he was born.
When we found out fetal surgery was an option, we immediately wanted to just say yes right away, because we wanted to do whatever we could to help the baby, but then we found out some of the risks, so it was more complicated than that.
We are doing this to treat the baby, not the mother, and yet she's undergoing a very complex operation, so we have to be cognizant of her safety at all times.
Putting together this team with the fetal treatment program at Hasbro, Women and Infants, and Brown University effectively eliminates the barrier of the uterus to repair. So we're able to find problems and then, using the talents of the different subspecialists, do everything we need to do to fix things before the baby is even born.
This is an actual 3D model of Selwyn about 2 weeks before we operate on him, at about 22 weeks gestation. In yellow you see the spinal cord that runs down the back, and right here is a defect where the spinal cord is exposed to the outside, so not covered by skin. By closing the defect, we prevent egress of fluid and we prevent herniation of the brainstem. That also has an effect on the ventricles. In green, this is the fluid within the brain, so hydrocephalus, or water on the brain, means that those ventricles are dilated with too much fluid, and that too can be fixed with fetal surgery for spina bifida.
Selwyn is doing really well. He's very loved by his big brothers. He's so far meeting most of his milestones. His legs are moving and kicking. He has movement all the way down to his toes, and we still check in with the neurosurgeons regularly to see how his back is healing and how he's moving. They're still following the changes in his brain, but because of the fetal surgery, he had some really good benefits to his brain.
We saw him at about 2.5 months of age with his family, and it was a very happy, emotional reunion, and to see how well he's been doing, growing like a otherwise normal child and having pretty good strength in his legs, and it certainly bodes well for the future.
We're very glad that we made the decision, and we're very glad that everything went well.